While the goal of this program is to help patients insist on better care, there may be factors that impact their access. What common obstacles do patients face?
The main obstacle for patients is insurance. Unfortunately, I find that it's frustrating to not be able to provide patients with oral hormonal therapy if they can't afford it because they don't have insurance, and it's too expensive. But there are other sort of challenges that patients face, right? If they're young and don't have childcare, if they have trouble getting time off their work. But I think one of the major problems is economics, and can they get the same care, and can they advocate for themselves, right? So another problem is if you are in a community practice, you might not have access to the top diagnostic testing. And it's really important that you advocate for yourself and get a second opinion at an academic center where you can get the best testing and figure out the best path for yourself. And sometimes if patients are at sites where they're seeing a generalist, they're not going to get access to that because that's not standard at that hospital.
Yeah. Well, what is the medical community doing to help improve access?
We are working hard on reaching out into the community. One of the other hats I wear is I'm Associate Program Director for the Johns Hopkins Clinical Research Network for Oncology. And one of my jobs is to find communities that want to open trials at community sites. These aren't super complicated phase 1 trials. These are often simple phase 2 or phase 3 trials that patients can participate in and really get access to new biomarker tests, get access to new treatments, and really be connected to the centralized knowledge that is available at academic centers. And I think all of ASCO is doing this. I think all of the Prostate Cancer Consortium is doing that. I think the PCF is doing this, and we really are, and I even think the drug companies are reaching out and educating primary care doctors, urologists, radiation oncologists, patients. There are a lot of programs we now do that are direct to patient education, so that we're not dependent on whether or not the doctor has time to explain these things. And so programs like this are really wonderful at keeping the patients educated and able to advocate for themselves.
Diversity in clinical trials, is that an emphasis for the research community?
Absolutely. I think that's an emphasis across the board in society today. We are eager to learn more about how patients with different genetic profiles, with different ethnicities, with different socioeconomic backgrounds, are reacting differently to different therapies. If you're African American, do you respond differently to Sipuleucel T with one study we looked at? If you have a different diet, are you going to respond differently to immunotherapy? And really understanding different demographics is really important to us at this time.
Are there resources that patients can turn to that would help them gain better access to healthcare?
There are programs that are available either through your local community, or another one that has a nice patient-centered education program is NCCN, or the National Comprehensive Cancer Network. They have summaries of your tumor type across the board and how to best treat it. They also have a list of experts that help make those guidelines, so that you could reach out to those centers and know the main centers that are treating your cancer.
That's great advice. Thank you. If a patient is feeling like they aren't getting the best care, though, what steps should they take to change that?
That's a good question. So being a self-advocate takes energy when oftentimes you're tired and overwhelmed at your cancer diagnosis. And so my heart goes out to all of those patients. Really finding a second opinion and finding a academic center or a large program that has a prostate cancer focused program is helpful. Or whatever your tumor or issue is, going to a center that is a specialist in that for a second opinion is often helpful and can work with your local physician to help get you the care that you need.